Okay, well, good afternoon, everyone. Thank you, everyone, for joining. So we've been doing or trying to put together some information for families and providers about Indigenous birth practices, and we thought talking about birth plans would be a great place to start. Always looking for new ideas. If anyone has a topic they want to provide a presentation about or know somebody who would present, I think for Barb and Mary, it was more of me volunteering them to do this than them actually volunteering themselves. So appreciate that, but they definitely have a lot of information to provide. Mary and Barb have both been working with the home visitation program over in LCO. Minimajdaewin, right?
Yes.
Okay. My mind blanked on it. But they've both been active in that program for, I'm not going to guess how many years it's been over there, but also Barb is very active in as an Indigenous doula and has some other experience with breastfeeding support and things like that. And Mary, I think, has just been with the program providing support for the families as well throughout that time. So I will let you guys do any further introduction you want to do and then hand it off to you to talk about birth plans.
Okay. All right. Thank you, Sherry.
Okay, we're gonna get the presentation up.
Just gotta wait. We're gonna put the presentation up.
And almost done. Oh, wait,
Oh, hey guys, can I just ask, I know we talked about questions. If people have questions, do you want them to hold till the end, or do you want to just ask as they go? What would you prefer?
We can ask as they go, and if they have a question, they can put it in the chat, and you can
Interrupt?
interrupt me when you think a good time is.
Okay, sounds good.
Okay. All right.
All right, so feel
Mary.
free, if you have questions, drop them in the chat. We definitely want to make sure we get them answered for you. Okay,
Okay.
sorry, Mark, go ahead.
Yeah, we're just waiting. Mary's trying to share the screen.
all right.
Okay, there we go. All right. Well, good afternoon, everyone. Thank you for spending a little bit of your day with us today. Today we are going to talk about a birth plan that I and Mary have put together. Mary and I put this birth plan together when I worked for the Minimajdaewin program. And then when I moved from the Minimajdaewin program to the maternal child health program as their program assistant, I brought that program or the birth plan with me to use in that program. The program that I work for is the Giganan program at the LCO Tribal Health Center in the Maternal Child Health Department. Mary, I have this thing on my screen.
Oh, is that distracting you?
Yeah.
Okay, you're just gonna have to move that over. I don't know how to operate your laptop, sorry. How's that?
Yeah, that works
Okay.
perfect.
Oh. No, you'll have to
Yeah, I don't know how to
do view, hide self, maybe.
view. No. View.
That one, side by side speaker. There you go.
Okay, there we go. All right. Sorry about that, guys.
Everyone's faces were across her screen and she
Yeah.
couldn't see the slide.
I couldn't see my slide. Everybody was across the screen.
And we weren't worth looking at, huh?
Yeah, so go ahead, Mary, and now you can.
So Barb works in the maternal child health department, and I work as the grant manager for the Minimajdaewin home visitation program. And I've been there since 2011, so 12 years. And we are both employed by Lakota tribe, and we are located up in the northwest corner of the state of Wisconsin. So Barb's gonna start talking about what is a birth plan.
What is the birth plan? Well, a birth plan is a plan that we designed, and what we did is we went and we looked at a bunch of different birth plans from the Hayward Hospital and on the internet and from other places, and we kind of designed our birth plan to fit our needs here within the LCO tribe.
Mhm.
So what a birth plan is, it is a plan that helps you think about what you want your labor and delivery to be like during, and what you want your hospital stay to be like once baby has arrived. So what we try to do is we try to get the prenatal mom as early as possible so that we can give them this birth plan because the earlier we start out with the birth plan, the better, because then they have more time to think about how they want their birth to go. This is a tool or a means to let the doctors, the OB department, to know what you want your birthing experience to be like. Next slide.
Yeah.
So,
So our birth plan, or Bob's birth plan, the birth plan has 6 parts to it. And as you can see, they are listed on the screen, along with a brief description of what each section covers. And each section is also broken down in a way that makes it easy, like to start and stop at different appointment times, because sometimes Barb is able to get through this, all in one setting, and sometimes, she's not able to because just of different things that happen. So it's easy to say, okay, at the next time or the next appointment, we're going to talk about like the infant feeding plan, for example, or whatever topic the birth parents would like to cover that they haven't talked about yet or covered yet.
okay, so this does seem like a lot of information to cover. So let's look at each section separately. Okay. So the first section is the support system. This is one of the most important things about labor and delivery to think about, and who you want to be there to be your support during labor and delivery. What do you want to think about? You want to think about who's going to be there to help you fulfill your wishes. Who's going to be available at these times? So on this part, this is where you're going to list the people that you want there, what their relationship is to you, their contact information, who do you want them to be present during labor? Do you want them to be present during your delivery? So you either just mark, put a check mark or put yes or no into those places. And sometimes things happen really fast during labor and delivery. So by giving us this information, we are able to contact these people for you if things are happening way too fast.
Yes. And sometimes that can happen.
Yes, I mean, I had to deliver a baby in my car because it happened so fast. Okay, so we also want to know in this next section, which is the relaxation techniques. What do you do to relax? How do you relax your body when your body is so tense? And you need to relax your body from head to toe. And also, we don't want to forget about the dads. How do dads relax? Or your partner relax during this time? Because they can get all excited and tense and everything, and mom is screaming and hollering at him and telling him, get away from me, and this is all your fault. And I've heard a lot. I'm not going to say a lot of what I've heard. But as labor begins, we want to know what calms you down and makes you relax. This is a time to have a discussion with moms about what is allowed and what can be brought into the hospital to help you fulfill this request. We want to make sure that the hospital allows you to bring things in, say like aromatherapy, listening to music, having your own music there, dimming the lights, and it's things like that. And we want to know, we want you to be as relaxed as possible during such a difficult situation, a hard time, because during labor and delivery, it's really hard to relax when there's a lot going on. Yeah, and a lot of moms aren't aware of this. Is also a good time, like I said, to check with the hospital to see if these things are available to bring in. And Mary and I took a tour of the birthing center the other day, and they do have an aromatherapy thing in there. They have a CD player or a little thing that you connect your phone with so that you can listen to the music or whatever kind of music you want to do. They have hydrotherapy. They got an awesome jacuzzi tub in there, birthing balls. And so let's go on to the next one. So this next section is labor and delivery. Now this section is 2 pages long, but these are important points to know about what you want during labor and delivery. What is your role or your partner's role for what your wishes are? But you also have to keep in mind that the wishes that you have in this section can be met only if it is medically possible and there are no medical concerns present. So if mom's heart rate drops, her blood pressure goes up, baby's heart rate drops, we got to make sure everything is before your wishes can be met and kept only if it is medically possible. So this is a lot to think about and plan out. So it is good to think about some of these things that are in this. And people do have, like Sherry said, we sent a link to the birth plan so you can look it at. We're not going to go over both pages.
It's also important to note that like most first-time moms aren't aware of a lot of these things.
Yes.
So it's good to cover labor and delivery and what is allowed, what's possibly could not be allowed.
Yes.
It's good to cover that with moms, especially first-time moms.
Yes. You're right, Mary. It's just first time moms. They don't, they're not too know about everything that's gonna that can happen or what's going on during that. So we want to make sure that they know everything that they can and cannot do or what they want to do during this time, during the labor and delivery section. And so for our next section, we talk about the infant feeding plan. So what is an infant feeding plan? Well, the infant feeding plan is, are you planning on breastfeeding your baby? Are you planning on breastfeeding and formula feeding your baby? Do you want to give your baby a pacifier? If you want to give your baby a pacifier, do you want the nurses to ask you permission first before you they give that baby a pacifier? Do you want to pump and bottle feed without formula? But you do not want your baby to get a pacifier again without your permission, especially if you're going to breastfeed, because you don't want to confuse the baby between a pacifier and a bottle when going to the breast, because that will confuse them.
And this lets the hospital staff know what the wishes are.
Yes. Yes. Great. Good job, Mary. Sorry, I don't know, I'm getting a little nervous. Um,
You're doing great. Just, yeah.
yeah, and then
Talking to
we
friends.
also know that when we did the tour of the birthing center with Eileen yesterday, that babies, it's a baby friendly hospital, a breastfeeding friendly hospital, and babies are kept in room. And they are left after baby is born, they're left for an hour, 2 hours, however long the mom wants, um, in the labor and delivery room before they are taken to the postpartum room. So they have all that privacy there in the labor and delivery room. All right, so in the next one, and I already started on the on the next slide, which is the golden hour. What is the golden hour? It's the first hour, 2, 3 after baby is born. This is so important for bonding time between baby, mom, and partner slash dad. Um, to have that skin to skin, to get that baby to latch on. It keeps the baby warmer. A baby is more calm when they have that skin to skin contact. Babies can hear the mom's heartbeat, or if the partner is holding the baby, can hear baby's heartbeat. Their heart and breathing rates are more normalized. And the milk supply may be improved by doing that instant skin to skin after baby is born. And also in part of this labor and delivery plan, or this birth plan that I forgot to mention, is what is really important is once baby is born, we want to we want to make sure that before the doctor clamps and cuts the umbilical cord, that we wait that 10 to 12 minutes for the for it to stop pulsating before we cut that cord, because a baby can get a third more of its blood that it needs if you wait that period.
No.
And I believe it's in this plan. If not, I will add it.
Okay.
I know it was in there before, but we've been messing with it and changing things. So yeah. So this is important for other families to know that they can hold and bond with the baby after this golden hour is done. We call it the golden hour, but it can be longer than that. And this also, by putting it in the birth plan, it helps the mom by having the nurses kind of explain to the family that they're not being shunned away, they're not being kept away from the baby. This is an important time where they can bond, and the nurses will explain to the family and friends why they have to be have to wait.
Mhm. Yeah, that's okay.
And the last part of our birth plan is the consent to release information. Why do we do this? So that everybody involved is aware of what you want during your labor and delivery, and they can provide support if they are able to. So what it is we're going to, once this birth plan is completed and finished, and we've gone over it and reviewed it, and you're okay with everything that's in there and you don't want to make any changes, then we deliver the birth plan personally to the doctor's office, and then we want to know what clinic you're giving it to. We hand deliver it to the OB department so that we can go over it with the nurses in the OB department before you even come to the hospital.
Mhm.
If you want this released to the Indigenous breastfeeding counselors, we have probably 3 or 4 here at LCO. So we give them a copy of it. And I think what we would do is just give them a copy of the feeding plan, so that they know what your feeding plan is. And we also keep a copy in the Giganen program. And if they're enrolled in the Minamaja Saywin program, they also get a copy. And the purpose of this is to coordinate care during labor and delivery and during for the feeding plan with the breastfeeding counselors.
Mhm.
Awesome.
So as Barb has mentioned, one of those places that receives a copy of this birth plan is the OB department at Hayward Area Memorial Hospital and the family birthplace. And one of the nurses there, Eileen Fromo, who's a registered nurse in the hospital nursing department, she is one that Barb works very closely with on these birth plans. And she has offered to share some of her thoughts on how the birth plan has been working for them at the hospital.
And how helpful it is for them to know ahead of time of what the mom's wishes are.
So we're going to listen to Eileen.
Did you guys push that share sound when you shared the screen?
I did.
Okay.
It's not. I did. It says share sound.
Did it again, maybe.
Can you see that?
Yeah, I can see it on yours, not on mine.
Share sound.
Your computer is muted.
No. Let me.
We just listened to it a little while ago before when we did a little run through. Sorry about this, guys.
Let me. Do I have to stop share?
Do you want to stop share and then try again? See if that
Yeah.
worked. Seemed to work
I-
yesterday.
Oh, maybe this is why. We're sitting really close to each other.
So maybe I should mute mine.
Wonderful tool. The birth
Oh,
plans actually
There we go.
staff
Let's start it
that
over
we're
from the
all kind
beginning.
of.
We can hear it now.
How have the birth plans been helping? They are really a wonderful tool. The birth plans actually individualize the person, the client, as to what they want in their for their labor, for their delivery, and caring for them and their infant. And that's what makes the needs, I think, are very helpful because that makes them feel like, oh, okay, this is what I want in my, this is what I want my labor to be like, and so on. So it helps for reassurance and calmness, I think, for the client and this, and also what it does too, it's a cohesiveness between um, the client and the staff, that we're all kind of on the same page to meet the needs of the individual. The benefit of that plan is that we try that it again helps the client and their significant others, that we are meeting the needs of them. So let's say they want like aromatherapy. We know that, or maybe they don't like aromatherapy because they might have sensitive to the smells and things. So we'll know how we can best care for our clients.
Yay. Thank you, Eileen. Okay, so does anybody have any questions? This is all my contact information and things up there. All my certifications. I'm a certified community-based doula, a certified lactation specialist, an Indigenous breastfeeding counselor, a national nutrition counselor, an infant massage counselor, and a child safety technician. So this birth plan is a work in progress. We have been reviewing the plan and updating it. So if you see anything that you would like to change or add, just let us know.
And we do have a question. Go ahead, Leah.
Also, thank you for sharing this with us. It's really helpful to me. I'm going to be definitely making one for our community.
Yeah, go ahead and use anything that you want in there.
Okay, thank you. I guess my big question is, as far as connecting to the nursing staff in the hospital, as an agency or as a doula, or even just as the mother who's pregnant, and bringing this forth, what was the best way to do that? How did you guys just call and set up an appointment, or did you just?
No, usually when it's done, I've been doing this since 2011, 2012. So I have a really good connection with the OB department and the nurses in the OB department. So usually what I do is, once I get a birth plan done and it, the mom signs off on it and everything, I make the copies. I just take it out there, let the OB department know that I'm there. And then we sit down and we go over the birth plan.
How did you get to that point? I think is the question.
How do I get?
Like when you first started out, how did you connect with the hospital to say, hey, we want to do this, we want to try this birth plan thing? What was that like, that
What was it?
relationship building?
It wasn't really a good relationship during the beginning. It was hard for, me as a doula, to get into the hospital and start, being there as a doula during helping a mom during labor and delivery. So I don't know, it took a while to establish that trust and that relationship with the hospital. But we're in a really good relationship. You just got to keep working at it and don't let them intimidate you, because doulas are very important and this birth plan is very important. So hopefully, it might take a year to get that relationship established. But now I have an established relationship with the nurses and the doctors in the OB department, the OB doctors in the clinics. I even get phone calls from the doctors saying, hey, this person has missed some of her appointments, her OB appointments. Can you please get in contact with her? And I do. I'll get in contact with them and say, hey, a doctor can get you in today. I'll give you a ride. So, that we have that really good relationship where a doctor has called me personally to get these prenatal patients in for their OB appointments.
So when you bring the birth plan to the hospital, the mother signed off on it, and you said you guys sit down and meet. Is the mother there with you then? Is it like
No, because we've already gone over it.
okay?
The mother and I and the partner have already gone over the birth plan. And then once it's all signed, I make the copies and to make enough copies for who she wants to have a copy of this birth plan. And then I hand deliver them to them.
Okay.
Sometimes it is hard to coordinate with their schedules and our schedules. So usually when I take it to the clinics, because that's where I drop the one off for their OB doctor, I usually just have it in a sealed envelope with the doctor's name on it. I give it to the receptionist and ask the receptionist to deliver that to the doctor, so that they have a doctor in their file or in her file at the doctor's office, and the OB department has files for the moms who are soon to be delivering. So they have files for them already. And what happens is that after we go over it, they stick it in their file.
Oh, okay.
Yeah.
that's helpful. That makes
Yes.
sense. Thank you.
And like I said, it takes a while to get that, to build up that relationship with these doctors and nurses, even in the hospital, so. Any other questions?
And feel free either to unmute yourself or add it to the chat if you have any questions.
Barb,
Yes,
I have a question. I'm just curious. So do you find that they work pretty well? I mean, are the family's wishes pretty honored?
yes, they are.
Does it usually go pretty smooth, would you say?
Yes, and again, most of the time, 90% of the time, the birth plans are honored. Sometimes, things happen so fast that probably half of the birth plan gets forgotten about because
Sure.
things are going so fast.
Sure.
Like I had usually first time moms there in labor, pushing and stuff for hours. Well, we just had a mom deliver last week or so, and she pushed for 7 minutes and baby was here, and that was a first time mom.
Oh
And I'm
my
like,
goodness.
that went so fast that, we didn't even get to go, to
Right.
accommodate her wishes during the delivery part.
And that
you know,
was a first time mom, huh?
That was a first time, a young first time mom, yes. And I think she was in
Wow.
her mid-20s.
Wow, she was lucky.
I know.
That's great.
Yeah,
Good, because I often heard in the past that like you had said, it was hard making those relationships with the hospitals and OB department, and they just kind of wanted to do their own thing, so
yeah.
I guess it is very important to build that relationship because they might not always immediately accept you and accept that.
Yeah, and and the nurses, especially if there's a new nurse going into the OB department,
Yeah,
then you have to start that and build that relationship up with that nurse.
right,
So
right.
it just depends on what nurse is in the OB department, if you have already established that relationship or not,
Sure.
to make sure that the birth plan is followed.
Right.
So, and like, I know there's a few new doctors out at the Hayward Hospital, new OB doctors that I haven't even met yet because, with COVID and everything being here, we weren't allowed into the hospitals. So I haven't done a labor and delivery since COVID hit. So I'm trying to bring myself and put myself back into that role of being a doula and rebuilding that relationship with the OB department and the doctors and the hospital.
Sure. Okay. I
you know-
just have a really quick personal question. The golden hour, is that normally just for the moms? That doesn't include the dads, right?
No, that includes both parents,
Really?
mom and partner. Because
Okay.
it's important for the partner to have that bonding time with baby too.
Oh, that's funny because I just had a granddaughter that was born 4 months ago, and they wouldn't let my son hold the baby until after the first hour that the mom had her.
Oh, wow.
Yeah. And he
Yeah.
was really bummed. It was his first child, and he was really disappointed. But yeah,
Oh,
Yeah.
and usually when the baby is first born, as long as there's nothing medically wrong
right.
with the baby or anything, it goes right to mom's chest.
Yep.
And it is up, if mom wants to hand that baby over to dad,
Right.
that's perfectly, they let them do that.
Huh,
Because
okay,
it's their
interesting.
bonding, they have to bond too, so,
Right.
usually dad either sticks baby in his shirt or he takes his shirt off.
It's interesting how different hospitals do things then, isn't it?
Yes,
Yeah.
yep. Every hospital is different.
Right,
There's no two hospitals that are the same.
right.
Yeah, that's why you want to check ahead of time with the hospital to see if they would even, go by these, or what part of this birth plan will they honor
Sure.
during labor and delivery. Most of the time, I'm at the Hayward Area Memorial Hospital. And it took a while, but yes, they do honor these birth plans.
Good, that's good.
Do
to hear.
do they honor, say a family decides they want to smudge or they want to play their traditional music, do they honor?
They do honor, you can bring in whatever kind of music you want to listen to. And Mary and I were just talking about this before the presentation started, about smudging and saging. It's been a while, so what I know you can buy the liquid sage, the sage scent, where you can put that in there. But what we want to do is add that, can we burn some sage?
But we gotta check.
What, during this time, if the parents want, but we have to get their permission first before we even put it in the birth plan. We have to see if it's okay. Some hospitals will let you smudge during, like the last hours of somebody's life and things like that. And it is good to smudge during, the first hours of the birth. That's part of our tradition. So that's something that we have to look into and see.
How about like the placenta? Do you guys, do they allow you to bring the placenta home for burial and do
That
they
is
honor
a
that?
great question, because as Mary knows, I've had several placentas at my home in my freezer.
No, I don't know that.
That is in the birth plan. That if they want to take their placenta home and bury it. So yes, they do, if the mom wants to take the placenta home and do a ceremony and bury it, that is honored. And most of the time what happens is the mom will sign a release paper, and I take the placenta home with me, and stick it in my freezer until the time comes to do the ceremony, to bury that placenta wherever the parents want to do that at. So yes, they completely honor that here at Hayward Hospital.
What kind of release? Is it just a person, like a
It's-
release for you to take it, or?
It's a release that the hospital has to take. I don't even know what, it's been so long since I've seen it.
Is it
Yeah.
like medical waste or
it's
something
giving-
like that?
Yeah, it's giving, what it is the mom giving me permission to take the placenta home. Or it's the mom gonna take the placenta home herself. But what they don't like to do is leave it in the refrigerator in the hospital. So that's why they have me take it home. And then when they get out of the hospital, then I release the placenta to them.
Nice. Yeah.
And then I help them with the ceremony. We'll go and they'll pick a spot. Dad will dig a hole. We'll do a little ceremony, have some berries. There's some red cloth, and we'll do the ceremony and put that placenta back to Mother Earth, where the parents decided that will be the resting place for that placenta.
Do you have a song?
No, I don't.
Yeah. Neither do
I
we.
am,
I was look-
I am second degree Medewan, and I'm really been working a lot with a lady in the cities. Her name is Doreen Day,
Mhm.
and I'm gonna have to ask her about that. I'm gonna write that down. A song. I do have water songs and stuff like that I can sing, but I don't want to push things on the parents. If they want that, then I will sing one of the water songs or one of the birthing songs. But that's completely the decision of the parents.
Well, thank you.
You're welcome. It's a great
There's-
question.
There's another question for you, Barb. I don't know if you guys can see this in the chat, but as a first-time mom, there are a lot of things on the birth plan that I had not considered. So thank you for creating this. Any tips on making a decision on circumcision? My husband and I are leaning towards not doing it, but have so much social pressure to have it done.
Ooh, that is a really good question, and I wouldn't know how to answer that. I would just say, that is your preference. You know, don't worry. To me, myself, I would say, don't worry about what everybody else thinks. Think about, what your feelings are, what your traditions are, and how to go about doing that, and making that decision and making the right decision for yourself and for the child. Next question.
Anyone else have anything on that? I just wanted to, in case anyone had any other experiences they wanted to share.
I've known some moms to our parents to have their child circumcised, and some that don't do it.
Yeah, were you gonna comment?
Yeah, I was really pressured, not even by anybody in particular, but just in general. I didn't know traditionally we didn't circumcise or at all. So later on in life, I thought, you know, I'm not having any more kids, but if I had the chance, I would go back and not have my sons. I have 2 sons. I wouldn't have them circumcised, based off what I learned traditionally and why they do it, and medically, I think they do it for reasons in my head that and that don't need to be done. So
Now they label it as cosmetic surgery. It's a cosmetic thing. There's no reason why to do it, that it has to be done. And if I would have known that too, my children are in my 5 boys are in their 30s and, you know, early 40s, but I wouldn't have had them circumcised either, because back then, you know, we were shunned from doing our traditions and our ceremonies and all that stuff. Now that we're going back into doing our traditions and our ceremonies, and I wouldn't have had my boys circumcised either, just because it's not necessary.
Hmm.
Okay, and then you did get another question, which, just to clarify, does the birthing center allow smudging if the family or mom requests this, or was that something you were gonna work on?
That is something that I'm gonna work on and see, because I'm pretty sure that I would have to get permission, excuse me, from the administration at the hospital.
The smoke and the fire
Yeah,
alarms.
because we don't want the fire alarms and the sprinklers and all that to go off because of the smoke.
But there's a cedar or sage scent. Is it
Yeah.
aromatherapy?
Yeah, they have a sage scent for aromatherapy that we could use. And if you're not, I was thinking that if you're not allowed to burn the sage or to burn the cedar, if you have a fan, an eagle fan or a feather, just, you know, dip it in the cedar water and just take it and sprinkle it on the mom and the dad, or even after baby's born, take that and dip it in the cedar water and then just tap baby with it. That's just the same as smudging.
Well, you just got all kinds of good tips.
I know, and that just popped into my head because I've done that before. I've done that when we weren't able to smudge when my husband was in the hospital. They wouldn't let us smudge, so we put together a little cedar, a pan of water with some cedar in it. I had my eagle feather fan, and I just dipped it in there, and we just kind of smudged him with that.
Mhm.
Any other questions? Not seeing anything more in the chat. Is there anything that came to mind for anyone else? Okay, well, thank you everyone for joining us. A huge thank you to Barb and Mary for putting together the presentation, and Barb for the presentation and Mary's comments as well. We did record this, so we will be sharing that as well if you have anyone that you think would benefit from seeing that. And as well, we had the link to the birth plan, and we'll share that again. Again, I'll just say if anyone has any other topics they feel would be interesting to share about breastfeeding, nutrition, Indigenous birth practices, we're really hoping to get more information out to our communities and would love to hear from you. And so with that, I will say goodbye and thank you guys again for joining, and hopefully see you next time. Have a
All
good
right.
afternoon.
Sherry,
Great,
keep
Barb.
on.
Thank you.
Thank you. You're welcome.
Thank you.